Hello, and welcome once again to the Dental Marketing Mastery Series. This podcast is brought to you by dentalwebcontent.com and New Patients Incorporated. I'm Howie Horrocks, the founder of New Patients Incorporated. Along with me once again is my friend and partner and the president of New Patients Incorporated, Mark Dilatush. Hello, everybody, and welcome to our podcast.
Hi, Howie.
I think we're up to 42 now, aren't we, Mark?
42. It's amazing.
It is. It's amazing we can still talk.
It's amazing we still have stuff to talk about.
Oh, really? Yeah. Anyway, hey, I just want to give a shout out to my good buddies, Rick Coker and Brian McKay and Mark Whitmore down in and Rod Kurthy down in Texas this weekend. I went down to see them all. We had a great time. Rod gave a great presentation, and we played a little golf, believe it or not. So, hello, all you Texans. I love you.
There you go. There you go. All right. So what is on the docket for today?
Well, I'd like to start with taking a look at ROI. You know, where's your money coming from, dude?
Right. This is more of an extension of the commitment theme we started a couple weeks ago, right?
Right. Commit to really grasping a full understanding of all of the income sources that you actually have, because many of them are not that obvious.
Yeah, and this is regardless of who you use for your marketing. If you do your marketing yourself, if you use New Patients Inc. for your marketing, if you use some guy named Bob, a lady named Sarah, it doesn't matter who you use. This is the subject of understanding how to calculate ROI, what exponential ROI actually is, whether or not you can calculate it or count it, the importance of keeping the back door of your office closed. We're going to go into a little bit of that. That needs to be, for sure, a commitment that you make to your practice. And Howie and I would really like everyone to make a commitment, honestly, to yourselves and to us. Keep an eye on your capacity. There's a lady doctor whose first name is Lori, who's listening to this right now. That last section is going to be for you, Lori, and anybody in your particular situation. So let's go all the way back up to the top. The last commitment podcast we did, we ended at tracking your call source tracking and listening to your phone calls and understanding that the lady who works at your front desk, who's been with you for 23 years, really honestly has no clue where your new patients are coming from, and your new patients lie to you. So that's basically where we left off.
Yeah.
And so the tracking, the call tracking is really prerequisite to this conversation. So now let's assume that you are actively promoting your practice outside of the four walls that you practice in. You are putting some word on the street or off on the internet, and people hopefully are finding you. And you want to know, what is my return? What is my ROI? What is my return on investment? If I'm going to spend $600 or $700 a month on the internet, I really need to get $2,000 to $2,500 worth of new patient production each month from that investment. Same thing, long term. Same thing with almost every promotion you put on the street. So how do we measure that? Well, we get all kinds of different ways, Dennis, measure ROI. So in order to show you the right way, it may help you to hear some of the mistakes that we see all the time. I'll get dentists that'll send me new patient report for a month, like a certain month, let's say November 2016. And in that same report, we'll list out the new patients that we're seeing, and it will list out the production that was generated from those new patients for the month November 2016. And you might see 10 new patients, and you might see $1,000 worth of production. And if the doctor spent whatever, let's say $2,000 attracting those patients, the doctor calls and says, "Hey, I got new patients, but I'm not getting a return." What's wrong with that scenario? What's wrong with that scenario is, even though it feels and seems logical, well, to some, all you're measuring is the production from new patients within 30 days.
Too small a window.
Right. How many dentists on this phone call produce or complete treatment on their new patients in 30 days? Really? None. Two. Okay.
Yeah.
2 out of the thousands of people who listen to this podcast. Okay. But see, it makes sense to the dentist. The dentist is going, okay, new patients in November. Well, how much did they bring into me in November? Because I had a monthly marketing expense in November. So I'm going to line all 3 of those up and see how I'm doing. Now, it's obvious that the business of dentistry does not work that way anywhere on this planet or any other planet. Okay. But that's overlooked. So they do a 30-day snapshot. How much did I spend? How many new patients came in? That's your patient volume. How much production came in between November 1st and November 30th? That's the money part. And here's what happens to people who measure that way. They are never happy because they will never find a promotion medium that's ever going to make them happy because their measurement is wrong. Okay? So the only real way to do this right and to do this consistently from practice to practice to practice to practice, it almost doesn't matter what practice style it is. So regardless of practice style, the way to do this is to track your first year production from your new patients, not your month-long, not just what they produced this month. Because in my scenario, the scenario that I hear all the time, the November scenario, we'll call it. What if 3 of those patients came in on December 2nd, Howie?
Yeah.
What if they all got $7,000 worth of work? There's $14,000 in December that should have been applied to the new patient sources from his November report. He's never going to see them. He's never going to realize, man, that thing actually worked really well.
He could go on believing that November is the worst month ever for him.
Right.
And so he'll close his practice and go on vacation.
Right.
Out on a boatload of money.
Right, exactly. Or that marketing exercise or advertising avenue or whatever it was, whatever the doctor invested money in, he walks away thinking it didn't work. And then he goes, looks for another one, and then another one, and then another one. It's like this needle in the haystack, right?
Right.
How many doctors have you and I run into in our careers that have come to us saying, it's like I'm looking for a needle in a haystack, like thousands of them, right?
Yeah, I think so.
and it comes down to them not understanding the business metrics of dentistry, right?
Yeah, this looking for a one-shot solution.
Right.
I'm going to put this ad out and get 400 patients.
Right.
It's impossible. That's ridiculous.
Right.
It doesn't work quite well.
It never does. Right. So even a 1 year measurement, even at 1 year in the business of dentistry, because let's go through a scenario. Let's say that now here's the right way. The right way to do it is to measure your first year production from the patients who were attracted by your advertising. Okay, that's the first step to doing it right. So that's what we're asking your commitment for, is to measure your ROI on an annual basis. Can't possibly do it right on a monthly basis, nor can you do it right quarterly, half year. 1 year is the earliest you can do it right, and it's still not complete, but that's a good starting point. So that's your commitment. I'm going to start measuring my ROI by the year. But even at a year, so let's take the same kind of scenario. Doctor comes to me, says, Mark, I don't know if I'm getting my ROI for my money. Okay. How much are you spending? I'm spending whatever, $20,000 on this thing. And all right, so show me all the patients that came in, the volume of new patients, and show me the production from all those new patients over the last 12 months. And the doctor will come back, and inevitably he spent $20,000. It's only brought in, let's say, $27,000, and it was whatever, 13, 15, 20 new patients. Now, that's a good start. A 1 year ROI analysis is a good start. That's where you drop that number into a spreadsheet and you just keep tracking it every month going forward. But is that even accurate? What if 2 of those 15 patients that he brought in for the 20 grand come in tomorrow after he runs his report?
Right.
What if they come in and get their all on 4 cases completed? What if another $30,000 hits?
Yeah, exactly. You presented the case 6 months ago.
Right.
And they, okay, now I'm ready.
Right. And when does that happen? Almost always happens around the turn of the year.
Yeah.
Right. Benefits wear out, benefits renew. Oh, guess what? I'm ready. Right. So it's real easy for us to see how this is even flawed at 1 year. But 1 year is the commitment you make. You measure your ROI by the year, not by the month, not by the quarter. Okay. So we already came up with scenarios why even a 1 year ROI is not actually accurate. It's only accurate at telling you the money you've already put in the bank. So what is it not accurate at being able to do? It's not accurate at being able to project, right? To project out. How much more revenue are those 15 patients going to drive into my business over the next year, 2, 3, 5, 7, 9, 20 years? How much more revenue? You don't know that. But if you spent 20 on an advertising medium and you drove in, whatever, 27,000, and there's 15, 20 new patients on the books, I think it's a true statement to say that what you're looking at on your 1 year ROI is the absolute least it can possibly be.
Right.
Right?
For one thing, we don't know how many of those patients are going to refer their friends and family. That's an unknown, but we do know that it won't be 0.
And that's the next part of the commitment of understanding and measuring ROI, which is all I've discussed all the way up to this point are first line responders to advertising. Here's what a first line responder is. You spend money on advertising, your phone rings, a new patient makes their appointment, comes into your practice, and you do X dollars of dentistry to that person, the original first line responder. Okay. 99.99999% of the dentists listening to this only measure first line responders. Now, those same dentists will boast to me that they have a 46% referral rate. So patients, especially good patients, are referring, usually their children, 6 months later, their husband kicking and screaming, maybe a friend or two, a coworker or two. These are your secondary and tertiary referrals from your first line responder. What is the ROI value of those people? How much production did they bring into your practice? Doctors were just trying to open up your mind. Okay.
Yeah. Many docs will not consider that. They won't source it to the original medium or marketing effort. For some reason, it's not related. Well, what do you mean it's not related?
Right, right, right.
Patient shows up from having listened to your radio spot, plunks down some money, and then, a year later gets her friend to come in, and it's not related to the original marketing effort.
Well, of course it is. Yeah, of course it is. Or she's the head of her church, and 93 people come in, and they bring their kids and their husbands and their family. Right.
Yeah.
I mean, it's almost, and Howie's right. It's never measured. And honestly, we're not, this is not a critique of the dentist listening to this. None of you can measure it. There's nothing in any of your software that says, give me a viral referral report. It doesn't exist. So we're not saying it's your fault. We're simply saying, just because you don't have a viral referral report as a selection in your practice management software does not mean that your first line responders do not refer. And it definitely does not mean that you shouldn't consider the production from those referrals, whether secondary or tertiary, to be a part of the ROI calculation, because they should be.
Yeah.
Okay, that's what we're saying. So that same $20,000 investment that initially showed $27,000 in 1 year of first line revenue, hell, that could be worth $175,000. And if you don't chase it down and you don't look for yourself, nobody's going to look for you. You're going to make bad decisions. Absolutely, you're going to make bad decisions.
Yeah. And then it gets, like you said, it's almost like a tree with lots of branches on it. There's primary, first line, there's secondary, there's tertiary, there's, I don't know what the word is for fourth.
It's ancestry.com.
There you go.
If the whole tree starts at you and all the branches. DNA. Exactly. So from what we just described was exponential ROI. Exponential ROI in a dental practice are any secondary or tertiary referrals and the production from the secondary or tertiary referrals beyond the first line responders. You always measure your first line responders by the year. So every month you go to your practice management software, you go, okay, give me the production by referral source report between last year at this date to today's date. You run your report, and those are your first line responders. And you just jot them down on a spreadsheet. This referral source, advertising source, netted me or got me X dollars, produced X dollars from first line responders. Now, once every quarter or once every year or whenever you just want to take a look, list out all those first line responders and then go look for them as referral sources. And you're going to find that your ROI grows exponentially if you promote properly and you target the right people in your community, and you attract value-minded dental consumers to your practice. They will refer like-kind, value-minded human beings. And you will see that the average revenue per patient that you enjoy in your first year will be almost identical to the average first year revenue that they refer into your office. It's wonderful. If you look at it from a business metric standpoint, it's nirvana from a business standpoint.
Yeah, it's the Holy Grail.
It's the Holy Grail.
This will continue pretty much for the life of your practice, for as long as as long as you don't make somebody mad, or as long as they don't die or move.
Right.
All of these people are going to be with you probably for the life of your practice.
Yep.
Okay, and how much is that worth?
Exactly.
So if you were to go into the future and see that, and then come back to the present where you decided, oh, that wasn't a good enough ROI, I think I'm canceling this radio thing or this internet thing or this direct mail thing, because you would shoot yourself.
Yes. Yeah, because you're going to be looking for a replacement for the rest of your career.
Yeah.
So another key commitment we'd like you to make to yourself is making sure that the back door of the practice is as closed as it can be. We understand people die, people move, people, people change jobs, change insurance. There's all kinds of reasons. Oh, heck, there's insurance companies are pulling their shenanigans in different states throughout the country right now. So there's going to be, I'm not going to say it's going to be an exodus, but you're going to have attrition in a lot of those dental offices, who choose not to bow down to the insurance company. So the commitment is to keep an eye on your back door. Keep an eye on the people who are overdue for recare.
Yeah, you don't want to be, and we get this all the time. Initially, is you don't want to be a new patient junkie, right? Where you just have to have a billion new patients, or you're going to die.
Right.
Yeah, and that all comes from closing the back door. It doesn't do you any good marketing wise if you spend all this money and you get some good patients, and then due to sloppy service or something else that might be more under your control than you think, you lose them and you constantly have to replace them.
Right.
That's not a good scenario.
No, it's not. And so what you would do is you would run an overdue recall report once a month. I actually have a spreadsheet. You know what? If you want this spreadsheet, it's a difficult spreadsheet to adhere to because you have to run reports on the same day or about the same day every month, and you have to drop the data in. The reports are simple to run. The spreadsheet is unbelievably simple it's made for you. You just drop the data in it. But email Josh at newpatientsinc.com and just put practice analysis worksheet on the email, and I'll get you the spreadsheet. But anyway, what you're looking for is the number of overdue recare patients going up? Is it stable level, or is it going down? Stable level is okay as long as you have enough people walking through your front door. If the number of people walking through your front door is equal to the number of people walking out your back door, your revenue is going to plateau. Duh. If the number of patients walking through your front door is greater than, maybe double the size of the patients who are walking out your back door, your practice is going to grow. You're going to need more hours, maybe more chairs, maybe even more dentists. If the number of new patients that are coming through your front door is a half or less than half of the number of patients walking out your back door, your revenues are going to decline. If they haven't already declined, they're going to decline in at least 6 months. Or at the most 6 months. It's a foregone conclusion. It's going to happen. So this is one of the key indicators, is watching your overdue recare patients. And we'll have a podcast on recare because I have a whole half-hour vent on how dentists do their recare systems, but that'll come in a different day. Now, the last commitment for this podcast that we'd like you to make, and this is for Dr. Lori, and for anyone else who can't be seen by a new patient or makes it difficult to be seen by a new patient within 8 workdays. 8 workdays. We've been saying this for, I don't know 15 years.
Yeah.
It's the magic number of 8.
Yeah.
And when I say that to a dentist, they normally go, 8, geez, that doesn't seem like it's booked out at all. The magic number 8 describes the number of days that a patient would wait to see you.
Business days.
Business days. Okay. When you get to 8, you are perilously close to creating a scenario where you begin to get less impact for your marketing dollars, because you will attract new patients. They will call. And if they call and your front desk person says, well, the doctor can see you 3 weeks from now, there's a real good chance that new patient is going to choose somebody else.
Right. But you know what? They'll probably go ahead and accept the appointment.
That's what they normally do, is they accept your appointment, having zero responsibility or relationship with you. They go and make another appointment in a different dental office and blow your appointment off.
Exactly. And they won't bother to call, of course.
How many dentists have had new patient no-shows in the past?
Yeah.
You might want to align that up with how busy you were at the time, because a lot of times it's a cause and effect relationship. The busier you are, the more new patient no-shows you see. That's the cause and effect. So one of the commitments we'd ask you to do, or we'd ask you to keep in mind, is that number 8. If a new patient called right now, not an emergency, we understand you get emergencies in the same day. We understand. If a new patient called today, go out, look at your schedule right now. When is the next time you, the dentist, can see that patient? When's the first time you can see that patient? Now, if you want to add something realistic to it from a marketing angle, let's say, let's add something like a time of day. I'm going to give you a break. 4 p.m. I'm the patient. I'm calling your office. I prefer a 4 p.m. appointment. I'll even give you, it could be Tuesday or Thursday. How many days would it take you to see me on a Tuesday or a Thursday at 4 p.m? If the answer is more than 8 days, you are getting near or you're beyond your capacity. If you are, it's probably time to ratchet back your advertising and think about expanding your capacity. Okay?
Mm-hmm.
I know you probably never thought you'd ever hear a marketing company say that. Okay? But it doesn't make any sense to advertise to anger people. You spending money to disappoint someone.
Yeah.
That never makes any sense, right?
It's almost a forced growth thing. If you do want to, not everybody wants to grow their practice. Fine. If you want to stay level, then like Mark said, dial back on your marketing. But if you want to grow, you might have to look at bringing in an associate, partner,
add some rooms,
add some ops, more staff, that sort of thing to take care of the demand that you are creating.
Right. Get somebody in to teach you how to schedule appropriately.
Yeah.
Maybe go to 12-hour days, whatever the scenario is for your perfect life. It's right in front of you. If you're in that particular situation, you can mold this practice to basically to be whatever, to mirror whatever life and career you want to build. Just don't try to advertise your way through it, because we've had dentists who have come to us and said, yeah, Mark, we've been using this company X over here and not really happy with the results. And, invariably I'm like, that doesn't make too much sense. So I ask them right, off the bat, I say, geez, doc, if I'm a new patient, not an emergency, and, 4 o'clock on a Tuesday or a Thursday is good for me. Even a Monday's fine. How far out am I going to go? And if they say, March 3rd, like, that's part of your problem. No marketing company in the world is going to be able to generate more new patient flow out of a capacity that's already filled. Fill up a water glass with water and try to squeeze more water into it without making a spill. It doesn't work. The table gets wet. So that's what happens on the back end. So there's a good side and a bad side to these commitments. That's it for today, Howie.
Yeah, that was good. Thank you all out there for listening, and we'll look forward to connecting with you again very soon. Bye now. We hope you've enjoyed our podcast today. You can find more podcasts on our YouTube channel, on Stitcher, and iTunes. Also on our websites, dentalwebcontent.com and newpatients